And good afternoon, and welcome to Nursing News You Can Use with Baxter Professional Services and the Nurse Shark Academy. Thank you for being here. I'm Tina Baxter, and I'm your host. And this is a great day on February the 15th, 2023. Let's go ahead and get started with our affirmations for today. So, coming from the affirmation calendar here, I love this one. This is a quote attributed to Albert Einstein. It says, strive not to be of success, but rather to be of value. Strive not to be of success, but rather to be of value. Our second affirmation, avoiding a problem doesn't make it go away. Avoiding a problem doesn't make it go away. And lastly, my glass is not half full, it's overflowing. My glass is not half full, it's overflowing. So those are our affirmations for today, and these are coming from the Inspirational Daily Calendar here, and by Lauren Dratch. Lauren Dratch. So I really enjoy this calendar that I have now and these affirmations. So I thought for today, for our leadership moment, I'd come back to the What I'm Reading segment. And I wanted to share some insights from the 1 Minute Entrepreneur by Ken Blanchard, Don Hudson, and Ethan Willis. And this is in the chapter creating legendary services. And that made me think about the quote that we had from Albert Einstein, to be of value. So here's some of the insights that he had. He said, look for moments of truth with your customers to create the kind of experience you want them to have. Looking for those moments of truth. And I got to thinking about that because I had a revelation this past week that I was struggling with, and have had been struggling with, wanting to please people, being a people pleaser, and realizing that I was looking for affirmation, looking for that from other people, and not looking within myself, and certainly not looking towards God. And so when I recognized that, it showed how I had some areas where I had some blind spots, and some things that I needed to do and change. And so when I read this quote, it made me think about what are those moments of truth that we can have with our customers to create that experience that we want them to have, so they understand what we're doing and why we're bringing them into what we're doing. So as I was thinking and reflecting on that, I wanted to make sure that I bring value to you in this marketplace. The second point he had was listen to your customers. Discovering their ideas for improving the customer experience can make your company's vision and service even better. As you know, and I talked about this last week, I recently had a poll out on Facebook and LinkedIn to ask nurses about what's keeping them from starting their business. And from the responses I got, the number one overwhelming thing that nurses said was finances. And so I wanted to make sure that we speak to that in our program, that we help you find the way to finance your business. Look at ways for you to do the things that you need to do to be successful. And so those are some of the feedback that I've gotten. And that's some of the things that we'll be doing in our next challenge that will be coming up, is we're going to really hit hard on finances. So I'm listening to my customers. And then my last one, I love this. He says, don't create a company of ducks. Let your people soar like eagles to deliver superior customer service. My niece just put on Facebook, she put out something on there and says, I don't understand how people try to micromanage when they can't even manage. And that made me think about how are we showing up when we're working with our coworkers? Are we supporting them? Are we supporting everyone so they can soar like eagles instead of being in a company of ducks? So I found that interesting. So if you want to read more about this, please pick up the book. It's a great book. Loved it. And it's one I keep on my bookshelf because that 1 Minute Entrepreneur, just those insights are just little nuggets, that truth that keep me going. Okay. Let's get ready for our news segment. And this is always fun with our news segment. So let me get this pulled up here. And then we'll have some announcements a little bit later. to talk about what we're working on. But this is I do have some great nurses that are making a difference. But before we start on all of that, why don't we start here and go across the pond, because this is something we've been talking about, nurses on strike, and I wanted you to hear about what's happening in other areas of the world, because it's just as important as what's happening here. And so this is from the BBC News, and it says nurses strike, A&E and cancer staff could join further walkouts. So it says the Royal College of Nursing, the RCN, wants higher wages, but ministers argue that pay is set by an independent body. The union is considering a continuous 48-hour strike, which could begin in weeks. However, under union law, staff would need to meet the minimum legal levels of care. This involves providing care for the most urgent clinical situations as part of an obligation not to endanger life. The Department of Health has said our priority is keeping patients safe, adding that the NHS has tried and tested plans to minimize disruption. The action could be considered would go on for longer than the recent strikes held in December and last week, which each lasted 12 hours. So they're not backing down. They have a different system than what we have. They're not backing down, so they're going to have a longer strike. The RCN also said it may not take local agreements to help NHS managers during the strike periods, as it has done before. In previous actions, there were about 5,000 cases where the strike was not fully implemented, which were decided through joint committees of the NHS and RCN staff. A Royal College of Nursing source to NHS leaders are, quote, fearing this escalation and must bring pressure to bear on government to get it stopped. The union would have to give 2 weeks' notice for any action. Dates have not yet been set, it is understood, but could be announced within days. The RCN says it is frustrated that the government has refused to discuss increasing the 4% pay offer already made for the current 2022 to 23 year. So strikes and Wales have been called off after offers of 7% pay increase, while nurses in Scotland, who are members of the RCN and G&B unions, are not holding strikes while negotiations take place. The Department for Health has indicated that there is no change in its position for nurses in England, including on pay for the current year, one of the main contentions in the dispute. So again, we're seeing that this is just isn't here in the United States. It's all over the world that nurses are beginning to speak up and really let their voices be heard. So, you know, the nurses in New York striked, they were able to get their concessions. So I'm hoping the same for the nurses across the pond in the UK. But I just thought I'd let you know what's happening. So here's another story. And it's coming out of NJ.com, so New Jersey. This is a article here, and it says, they lost everything. New measure would prohibit nursing homes from preying on residents. And this I find abhorrent. That residents who were going in for nursing care, for rehab, suddenly found that they've lost everything. So here are some of the stories. State Senator Joseph Vitale says what happened to them was, quote, just awful. One woman said she returned to her home in Keyport from what she expected would be a brief period of rehabilitation in a Hazlitt nursing home, only to find it emptied of everything. Her bank accounts had been cleaned out, her car was gone, what had not been sold off had been tossed in a dumpster. She had not been burglarized. It was all taken away by someone working on behalf of the long-term care facility that had been caring for her after she was encouraged to sign a power of attorney giving him full authority over her assets and finances. The same fiscal agent moved tens of thousands of dollars out of the joint savings held by another nursing home resident with his sister, causing her to default on the property taxes for the small house they once shared, according to documents sent to prosecutors who have yet to take any action. That resident had also signed away control of whatever he had, including his pension, through a power of attorney. On Monday, in wake of those stories brought to light by the NJ Advanced Media, Vitale, who serves as the chairman of the Senate Health, Human Services, and Senior Citizens Committee, introduced legislation in Trenton that would set restrictions on the ability of nursing homes to manage the financial affairs of their residents. Under the legislation, co-sponsored by Senator Robert Singer, a Republican from Ocean, no owner, administrator, officer, or employee of a nursing home or any entity affiliated with a long-term care facility would be permitted to manage the affairs of a nursing home resident absent a order appointing that individual as a guardian. A companion measure was introduced in the lower house of Assemblyman Herb Conaway Jr., Democrat from Burlington. Specifically, this bill, S 3606 in the Senate and A 5194 in the Assembly, would prohibit anyone associated with a nursing home from managing the affairs of a resident, quote, except pursuant to an order of the Superior Court appointing that person as guardian. At the same time, the legislation would prohibit nursing home owners or their employees from acting under a power of attorney on behalf of a resident, as was alleged in the cases that were the focus of the NJ Advanced Media investigation into Future Care Consultants, a Brooklyn-based company that provides financial services to the long-term care industry, and its CEO, Shmuel Sam Stern. So if you don't remember, there was a movie that came out a couple years ago on Netflix that was kind of about this very thing. I can't remember the name of it. Maybe some of you remember the name of it. But I remember it came out and it was all about how they were signing up these people under false pretenses for guardianship. And they were just taking over these people's lives. And then the movie, they happened to sign up the wrong person who was well connected, and it kind of blew the lid on all of this. And that makes you think about how some of our most vulnerable seniors, they bring them in there, and you think about the fact that, maybe they're under the influence of medication, they're worried about their assets. They want somebody, water their flowers, pay their bills so they can go back home. And it may seem like a good idea, but yet these things happen. So if it's happening in New Jersey, I can almost guarantee you it's happening in other places. So according to the article, it says the account of those alleged abuses include the nightmare that Suzanne Aranio recounted after signing a power of attorney while under heavy medication. See, there you go. The document gave Stern, who has ties to a number of New Jersey nursing homes, federal records show, the authority to sell, transfer, or dispose of her assets, according to the lawsuit still being litigated. Ariano later returned home to find her home completely emptied of all its possessions, including her family photo albums, her televisions, her furniture, and all of her clothing. All of it was either sold off or thrown in a dumpster while preparations were made to sell her house. Even her car was taken away. It says 2 days after her story, it appeared in August, inspectors from the New Jersey Department of Health went to the nursing home where she had been living to inquire into the matter, according to the documents. It cited that the facility for alleged deficiencies in connection with the incident. Well, that's all well and good for citing them, but I'm like, who's going to give her stuff back and pay her stuff? And then, of course, there's Peter Bonanno's assets. Where there's a tug of war after he was admitted to a nursing home in 2019. Not long after arriving there, legal documents show that his sister, already holding control over his assets, Bonanno signed a new power of attorney, handing that control over to Stern. So again, it sounds like this, on the face of this, a very predatory practice. So then Stern allegedly soon liquidated 4 bank accounts that the 67-year-old man held jointly with his sister, moving their money into the nursing home's accounts. The facility then billed him at a higher private pay rate rather than the less profitable Medicaid rate as a result of the joint funds to which it had no claim, according to the attorney, and he told 2 prosecutors. Bonanno's sister would not learn that their savings was gone until bouncing numerous checks and defaulting their health insurance premiums and property taxes. Stern has not responded to requests for comment, obviously, although his lawyer said of Aranio's case that there's a lot of stuff out there that really doesn't fit the facts as she alleges them at this time. He characterized the complaint against Bonanno and Future Care as an issue that has been part of a collection process. So again, we talked earlier about how facilities are going after family members and things like that to pay these bills. So as you're seeing more pressure on nursing homes to be more transparent in how they're billing, you're going to see some of these cases come out again. So we're going to keep an eye on this. There's a lot more to this case. I encourage you to read the story from NewJersey.com. I don't have time to read the entire story, but I encourage you to do that because this is eye-opening, and it is also kind of scary that these things can happen. So let's go on to our next story. This is coming from USA Today. And it says, is your mom's nursing home owned by private equity? Biden administration wants you to know. The Biden administration today called for nursing homes to provide a complete picture of their owners and operators, proposing a new federal rule central to the president's plans to improve the quality of care and contain health care costs at the facilities. The announcement comes a month after a report from the Federal Government Accountability Office called for Medicare and Medicaid regulators to collect more information about nursing home ownership and to share it in plain terms with consumers. In a press call, U.S. Health Secretary Xavier Becerra characterized the draft rule as evidence that the president is serious about reforming nursing homes, noting he mentioned them in both of his State of the Union addresses. So, Mark Parkinson, president of the American Healthcare Association, described the rule as, quote, a distraction from the real issues affecting the quality of care in nursing homes, such as Medicaid payments that he said are too low and staffing challenges. He goes on to say, we support transparency and appreciate the administration's efforts to assist families and making more informed decisions. However, focusing on ownership and private equity is a red herring. The United States spends more than $90 billion annually on nursing home stays covered by two federal insurance programs, Medicaid for people with low incomes and Medicare for people who are elderly or have a disability. And according to the article, decades of academic research has found that ownership can significantly affect quality of care. According to Ashvin Gandhi, it is important to track given the extremely large public investments we make in this care for users who are often vulnerable. He's a health economist from the University of California in LA. We should understand what we're buying with our money. So the federal agency tasked with regulating nursing homes, the Centers for Medicaid and Medicaid, or CMS, has not tracked detailed ownership, even though it has had the authority to do so for more than a decade under the Affordable Care Act. Nursing homes could be required to submit new information about direct and indirect owners as soon as this summer. Now, again, we talked about previously how tracking who owns the nursing homes, these parent companies, because we've talked about how sometimes the nursing home entity itself, the local nursing home, is paying rent or leasing the land or leasing the building from the parent organization. So basically, they're just cycling the money back and forth. So those are some of the issues that are coming up. So we'll see how this comes out. There's more information in this report that I don't have time to go into today, but I want you to make you aware that these are some things that they're looking at in the federal government, and we'll see how this all shakes out in the near future. All right, this is coming out of the state of Connecticut. This was an interesting article. And this it says state 3 Connecticut nursing schools that are closing had low pass rates, unqualified instructors, invalid clinical experience. From WTNH in Hartford, Connecticut. It says 3 Stone Academy nursing school locations that are closing had low pass rates, unqualified instructors, quote, invalid clinical experience opportunities, and didn't adequately record student attendance, according to a letter released Tuesday from the Connecticut Office of Higher Education. Stone Academy told the state on February 6th that it would close its 3 locations in East Hartford, Waterbury, and West Haven. According to the letter, about 800 students were collectively attending 3 locations. The schools weren't reaching the required testing threshold to remain open as a private career school, according to the state. Practical nursing programs are required to have a pass rate of 80% on the National Council licensure examination. However, instead, their pass rates range from 43% to 70%. The letter also claims that 20% of Stone Academy's instructors were not qualified to teach practical nursing. The school also had invalid clinical experience in its campus clinicals, which were being counted toward clinical hours required to complete nursing programs. Campus clinicals are not allowed to be counted toward those hours. The school also did not properly count attendance, according to the letter. The state found compliance issues during an inspection in July and then another in a visit in December. The state then gave the schools notice on December 20th that it would hold a compliance conference meeting. And so I'm saying this, and I brought this story out not to bash these schools or anything like that, but I brought this story because we just had the recent scandal out of Florida with these fraudulent nursing schools. And certainly this school, wow, wasn't giving out fake degrees, they weren't in compliance with what they needed to do. And this is something that as individuals, particularly those of you that are in the Nurse Shark Academy, and you're wanting to open up an LPN school, this is important to know about what it is you need to do. And you need to look at your state regulations and what it says and what you're supposed to do. So while Stone Academy is accredited, I do want to say that they are accredited. Its accreditation body gave the schools a letter on February 10th outlining 12, quote, very significant compliance issues, according to the state. Students may be eligible for a partial tuition refund. They will also receive an official transcript for completed coursework. And it's something that has taken the students by surprise. Tanya King, who attended the school, says, I sacrificed so much being in school, like having little kids and having to work, balance being a mom. King said students were never told there were issues until they learned Stone Academy was closing. So that's really sad for those students. And I hate that some of these proprietary schools take advantage of the students that, you know, struggle to get into nursing school, and they want to do the best that they can and get it in a cost effective manner. And so I'm really sad that this happened to those students, and I would hope that maybe those that own those schools can find a way back to maybe not open up under that venue, but maybe they can reopen and do the right thing and hire the appropriate people. And that's where it's important that you follow those guidelines and know what you're doing when you start these businesses. Okay, so let's get to this last article. This just came in today. I just happened to pick this up and I dropped this in. This came from the New York Times, and I thought this was interesting because it says, according to medical guidelines, your doctor needs a 27-hour workday. So this is by the New York Times, and it says, the intent is admirable. Give doctors guidelines so they can be sure to cover what needs to be discussed with patients and help select options. Let's talk about your diet and any problems you might have sleeping. Are you getting enough exercise? If not, here is some advice. You're due for your colon cancer screening, et cetera, et cetera. He said, but there is a problem. There are just not enough hours in a workday to discuss and act on all the guidelines. Suppose an American doctor wanted a gold star when seeing patients and followed all the guidelines for preventative, chronic, and acute care disease issued by well-known medical groups. That would require nearly 27 hours per day, a team of doctors wrote in a study last year for the Journal of General Internal Medicine. No one could actually do that. So imagine a doctor shrugged off the chronic and acute care as well as administrative work and merely followed the preventative care checklist recommended by the U.S. Preventative Service Task Force and independent panel of health experts. That would be a 8.6 of the doctor's hours each day, according to a study in the American Journal of Public Health. So again, we would be spending the majority of our time just ticking the boxes and making sure that we've done all the things on the checklist. And that doesn't leave you time for the emergency care or the questions that people may ask or any of those things. And it's interesting. And according to the article, it says, as anyone who has sped through a 15-minute annual wellness visit knows, doctors cannot be so exacting. That the guidelines are so thorough, yet so often glossed over, prompts questions about their usefulness. At the same time, doctors' pay often depends on checking off guideline boxes. So this is definitely an issue. According to Dr. Michael Pignon, I'm not sure how to pronounce it, sorry, University of Texas. It says, suffice it to say that there has been incentivized isn't always what delivers the most health or benefit. Guidelines have become a constant frustration. According to Dr. Mina Johansson, a general practitioner in U, 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 Uddevalla, Sweden, who also directs the Global Center for Sustainable Healthcare at the University of Gothenburg. She worked with doctors in other countries on an analysis of the issue that was published last month in BMJ, which is the British Medical Journal. A lot of guidelines may seem reasonable when considered in isolation, but the cumulative burden of all guideline recommendations combined is absurd. And I can say that can be a really a big burden when you're trying to tick all the boxes and get all the things done. When does that actually leave time for you to have care? When does that actually give you time to establish a rapport with your client, your patient, to get to know them? And so this is an issue, and I'm kind of glad that it was brought out and to the forefront. It's going to be interesting to see what's going to come from this. And according to Dr. Mangione, it says clinicians do not and would never be expected to implement all of the suggested screenings, counseling services, and preventative medications in a single patient visit. When caring for patients, clinicians use both their judgment and the information obtained during conversations with each patient to prioritize which preventative services should be offered during each visit. Even that is not as easy, said Dr. Daniel Jonas, director of the Division of General Internal Medicine at Ohio State University. Guidelines can serve a purpose, Dr. Jonas says. I think they're incredibly helpful, he added. But he said deciding what to prioritize in a busy primary care practice is a big challenge. And so, again, you have all these different things that are coming up. And so we have to look at this and make common sense changes and approaches to how we implement care. So I'm glad someone's looking at that because it can be very difficult. All right, so let's get to our nurses making a difference. First, we have Ms. Eddie Bernice Johnson, class of 67, nurse, activist, and public servant. It says retired U.S. Congresswoman Eddie Bernice Johnson was a registered nurse before entering public office, thanks in part to her time at TSU. TSU is Texas Christian University. While nursing and politics are unusual confluence, when it comes to a career, both are about service, and Johnson believes her degree served her well in each. She said nurses have to have a broad view of those they're responsible for, like children, teens, working people, seniors. You have to be empathetic, respectful, and detail-oriented. As the first registered nurse elected to Congress, Johnson's initial career path started in 1955, where she received her nursing certificate from St. Mary's College in Indiana. It was one of the few colleges that a Black woman could attend. She says, I'd wanted to be a doctor, but my counselor told me nursing was the best option. You would thankfully not hear those words these days. I was so excited when I passed the board in 3 years. So I just want to say congratulations. She is one of our nurses making a difference. She has had an astounding career. Just to go back just a little bit into the article, she says that sense of activism that led her to politics as she went door to door as part of a grassroots effort to create more representation for Blacks in public office. Other crusades followed, and in 1972, she left the hospital to run for the Texas House of Representatives and was the first Black woman elected to public office from Dallas. Many firsts followed, including the first woman to lead a major Texas House committee, the Labor Committee. She says that still being Black and a woman wasn't easy in public office. I had so much to do. In those early days, there was open racism, but I put up with it and focused on the needs of the people in my district. Johnson introduced the National Nurse Act of 2011, and I remember when that came out, which would elevate the importance of the Chief Nurse Officer of the United States Public Health Service and appoint a national nurse to work with the Surgeon General to promote wellness and health literacy. Although her congressional committees did not have a direct jurisdiction over healthcare or nursing profession, Johnson served on many congressional healthcare task forces, and because of her leadership position, helped her congressional colleagues understand the Affordable Care Act and lack of follow-up associated with treating primary care patients in emergency departments. On November 2nd, 2022, she was presented the Lois Capps Policy Luminary Award. This award recognized leadership in advancing healthcare and the nursing profession at the federal level. She was recognized for being a champion of nursing, including introducing resolutions recognizing National Nurses Week, supporting Title VIII nursing workforce development programs, and being one of the original supporters of the Future Advancement of Academic Nursing Act. So, congratulations. She's a fellow Hoosier, although a native Texan. And so we'll say congratulations to Eddie Bernice Johnson. And so our next nurse making a difference, because there's two this week, and I thought, why not? This is coming from Florida State University, and an FSU, nursing professor has been named the 2023 Presidential Leadership Scholar. So congratulations to Associate Professor Eugenia Millender, who is the co-director and co-founder of the Center of Population Sciences for Health Equity in the College of Nursing. And she is one of 60 scholars who will form the Presidential Leadership Scholars 8th annual class. PLS is a diverse network of leaders who collaborate to create change throughout the world as they learn about leadership through the lens of the presidential experiences of George W. Bush, Bill Clinton, George H.W. Bush, and Lyndon Johnson and their administrations. The class was selected after a rigorous application and review process. Selection criteria included leadership potential and applicant success, improving the civic or social good by addressing a critical challenge faced by a community, profession, or organization. As an indigenous Afro-Latina nurse scientist, Eugenia Millender has dedicated her career to increase access to mental health care and provide culturally appropriate care. Her research focuses on reducing mental health disparities among indigenous and vulnerable populations. Millender works with community-based organizations and employs her expertise in mood disorders, stress, trauma, and how these are expressed through gene-environment interaction. She's quoted as saying, "I am honored to have the opportunity to represent the nursing profession and to be recognized in such a prestigious national fellowship. It is exciting to work toward improving systems of care surrounding homelessness, especially in the current post-COVID climate." So during the 6-month program, Millender will focus on creating a holistic process to assess and meet the needs of homeless clients with co-occurring medical or health needs in transitioning from hospitals to homeless shelters. She hopes to deliver evidence-based training to homeless shelter care teams and develop a universal toolkit for this subpopulation that can be used across settings to build system capacity and improve collaboration to prevent hospital readmission. So I want to say congratulations to this nurse making a difference. There's more into this press release, but congratulations to Dr. Millender, and very excited to hear about that. And that is our Nurse Making a Difference segment, and that ends our news segment for tonight. So let's get back to our events so we can be ready to wrap up. So our future events that are happening here in the Nurse Shark Academy, please take a look at our website, hop on there, see what's happening. We've got some great things that are coming up. It's nursesharkacademy.biz. You can visit us there. We have our Rest and Renewal event, which will be on February the 15th. That is tomorrow. So if you have registered for this event, please let us know, RSVP, if you're going to come. And looking forward to having that event tomorrow evening. And then we have our TB validation class, which will be February the 18th. So if you need to get certified to give and read TB tests, the skin test, please go ahead and register. And then we have on February the 22nd, our Give the Gift of the Peace of Mind Will workshop. That is free. All you need to do is register on Eventbrite. By the way, all these links are on Eventbrite. You can register on Eventbrite and join us for that. And then our legal nurse consulting basics will be on February the 25th, and that those event will also be on Eventbrite, and you can sign up. Just a reminder that the Nurse Shark Academy Show podcast is now live, and we just uploaded our latest episode on Monday. So please tune in. We post twice a month. If you know of any nurses out there that are business owners, and we would love to have them on the show. So we love to talk to nurse business owners and leaders and to highlight them on the show. I like to talk to the nurse next door. All right. So that is the end of our show today. Thank you for tuning in. Please don't forget to subscribe to our YouTube channel, like and share our content. Those of you that are on our Facebook groups, thank you for tuning in as well. Catch the replays there in Facebook or on our YouTube channel. And I want to say thank you for joining us today. You have a great day.